via the Jack Spring Electric Heel Newsmaker hotline. Dr. GE Ghali is Chancellor at LSU Health Shreveport. Dr. Ghali, welcome back to Keel. Thank you for taking time for us. How you been?
Good morning. Been doing well.
Let us start here. Can you, for us, in your mind, assess the current state of COVID-19 in the Shreveport-Bossier area? What you thinking? What you seeing? You're on the front line.
Well, yeah, we're seeing some rather disturbing increases, some of which we expected with, going from phase 1 to phase 2. We expected some rise in these cases. And, of course, the governor kind of kept us in phase 2 at least through the 24th of July. And I think rightly so, with some of the disturbing increases that we'd seen over the past. We were doing pretty well till about a month ago, and then we began to see increases in cases. And, a small amount of that, I think, could be attributed to our improved efficiency in testing. We were, number 3 in the country in tests per capita. But I think the other thing you have to look at, Robert, is some of the holiday gatherings and potentially some of these super spreader events that we've seen around the state related to various holidays. Most recently coming up is the 4th of July that we recently had. And, this lags a little bit behind. Usually if you're exposed, your maximum presentation is going to be 4 or 5 days later. So we should be seeing that here this coming weekend.
I would bet, and I bet you get this, every day, if not 2 or 3 times a day. Folks, friends, family, they say to you, Doc, I just don't know what to believe when I see the numbers. For example, I saw an article, in fact, a couple last night, and they said that nationwide, the death rate is down more than 90% since late April, from 2,750 the last week of April to 209 last week. You say the numbers you see are disturbing, but on the other hand, me and a lot of folks, we see stories and articles and statistics that say, but the hospitalizations and the death rates are declining rapidly. What do you tell folks?
Well, certainly the death rates are declining a bit. I mean, we're still losing, any death, Robert, is bad, particularly for the family and the friends. In Louisiana yesterday, I think we had 16 deaths. The day before we had 20. The day before we had 98. So, we've had 125 some odd deaths in the last 3 days in Louisiana. Those are significant. I will tell you that depending on what how those are reported and how long there's a lag in reporting of some of this, so I can see how some people would be concerned about that.
Excuse me just a second. I don't want you to finish. I want you to finish the answer in a second, but I want you to answer this at the same time. Are you, as a physician, are you as a medical guy, are you happy with, probably not the right choice of words, content with, satisfied with the way statistics are compiled and released?
Yeah, I think they're doing a pretty good job with that. I mean, could it be better? Yes. Okay,
but I wanted you to finish your other answer because I cut you off right in the middle. I'm sorry.
Well, no, the other answer, Robert, was we were somewhere between 6th and 10th in the country in number of new deaths reported in Louisiana during this past week. On average, this past week we were somewhere between number 5 and number 10 in the country in new deaths. Deaths aren't really something you can look at very easily because those really do lag behind, and sometimes testing is done post-mortem on the patients to see if they had evidence of COVID or not. I think more important is to look at hospitalizations, and hospitalizations in the last 2 weeks in Louisiana have doubled. They're not quite as high as they were when looking back, say mid-April, but relative to 2 weeks ago, the number of hospitalizations in Louisiana has basically doubled. The one good variable in there is the number of patients that we're having to put on ventilators is less. There's really two reasons for that. One is our doctors across the state are getting much better at taking care of the cytokine storm that we talked about before, the reaction that patients are having to the COVID that required them to be intubated. There's other modalities and medications that they're trying and using and are successful in using on these patients to reduce the rate of needed ventilation on these patients. The other thing is that people need to understand the number one age category right now in Louisiana for cases is the 18 to 29 category. Those patients are coming into the hospital and they're having to be treated, but usually because they're in much better shape and they're not as old as some of the more senior citizens that are dying from this. They don't need to be ventilated as much with mechanical ventilation or a ventilator. So, yeah, we're seeing increasing numbers, and it is alarming. And that's why we need to emphasize the use of masks. Particularly in situations where you cannot socially or physically distance.
I saw an article a couple of days ago. In fact, I saw it on TV too, and I'm sure you just get worn out from seeing every virologist and or medical expert in the world being interviewed on television these days. But this doctor said that eventually everybody in America will get coronavirus. Is that true? Do you believe that?
Well, I'm sure if he was an epidemiologist, he's very well qualified. I'm not an epidemiologist, but just as a doctor, as a surgeon, as a chancellor, as someone that's been reading this stuff for hours on end now. It takes up a major part of each one of my days. Just looking at it from a practical standpoint, no, not every person is going to get it. There's some parts, it requires person-to-person contact, and some people just aren't in that much contact with each other in certain rural parts of the United States. But ultimately, with a vaccine, everyone hopefully will be treated with it, and I think that'll probably be the way to go. So I don't think every single person is necessarily going to get it. And if we could guarantee that every person was going to get it and not get as sick as some of these, 3,400 people or so that have nearly died so far in Louisiana, then yeah, I would say that would be practical, but it's really not practical for everybody to get it.
The American Association of Pediatricians had a statement out earlier this week, said that they think schools should be reopened, i.e. reschools. That what they meant was that they thought that the health risk was not as great as the psychological risk of keeping children sort of confined at home. What do you think about that?
Yeah, I would agree with that. I think that's probably a valid statement. We need to get the kids back to school in the fall. There's a lot of variables in there, as you know, Robert. There's economic variables, there's health variables, there's psychological variables. We don't want to forget the parents that are working that depend on the school, for lack of a better term, almost like a high-powered daycare. Regardless of whether it's first graders or eighth graders. Parents are working and the kids can't necessarily stay at home by themselves. But you have to be careful as well. There has to be precautions that are put in. Sometimes grandparents end up being the ones that are taking care of the kids when parents are working, even without the coronavirus situation. And in that situation, those kids, the asymptomatic so-called carriers, could be making the grandparents at a pretty high risk of spreading the disease. So there's a lot of variables that are involved. But I think that the principals, the school districts around the country in Louisiana, they're smart people. They're going to be able to figure this out. Instead of shifting students from class to class, maybe you shift the teacher from class to class, and the class stays together, so there's not a lot of cross intermingling from one class to another. You have hand sanitizer. You take temperatures. You sanitize their hands before the kids go to the bathroom. After they come back to the bathroom from the bathroom, you have boxed lunches. You don't necessarily have a buffet. There's a lot of things that are established guidelines by the CDC, or they're really recommendations. They're not rules. They're recommendations. But I think if the school districts follow those recommendations, look, Robert, nothing is without risk. I mean, every single thing. I mean, school settings, university settings, those are areas that historically have always had some kind of disease process in them. It could be something as fairly benign as lice in your hair to a bit more serious like having mononucleosis or something like that. So they've always been an area where you can spread disease. So this virus is no different. Unfortunately, in that age group, it doesn't affect them as much as the older age groups. But you got to remember, you got teachers there too, and there's not a lot of bench strength with teachers. So, we can't afford to lose a lot of teachers. They would be more susceptible.
Last one.
So I think a combination of being very careful plus doing some form of remote learning for those that do get sick is probably the way to go.
Last one, real quick. I appreciate your time, sir. The mask mandate by the mayor, very controversial. What do you think about that? What's your opinion?
Well, my opinion is that it's the right decision for what we're seeing right now. I think that you mandate things hoping that as someone was telling me the other day, not everybody not everyone wants to stop at a stop sign all the time. But if you don't stop at a stop sign or stop at the red light and go through it, you could be affecting other people. And obviously, you could be affecting yourself. And so this is a similar thing. You want to protect a mask does protect you as well as others. Well, maybe it protects others more than it protects you, but it does protect you as well. And so, I don't care what you read. There is a significant amount of protection that's imparted to both parties when one wears a mask for multiple reasons. Remember, this virus is more of a dose-dependent virus. You have to get a certain load of the virus. So any covering of the face is going to help reduce the number of viral particles that are going to get in. It's not 100%, but you don't need 100% of the particles to come in. You can block out various particles, but you need a certain amount to actually get the disease and to be able to pass that disease on to others.